Imbalances there. This is RN Shweta and welcome to my channel Nursing with RN Shweta. So today I have come up with a very confusing yet very interesting and important topic of fundamental of nursing, that is acid-base balance. So I'm sure you all might have heard so many times about acidosis, alkalosis, metabolic acidosis, metabolic alkalosis, respiratory alkalosis, respiratory acidosis in clinicals, in hospitals, or even in the theory class from your teacher and your friends. And I also know that it is very confusing, right? So today I am there to help you out to have a clear concept about what exactly is acid-base balance. So let us move into it. Before diving deep into this topic, I want you all to remember some basic things about acid-base balance in our body. So the first thing I want you to remember is we have some parameters, very important parameters. Not some actually, we have 4 parameters, simple parameters that is used to describe, or that is used to distinguish between acidosis, alkalosis and categorize it into whether it is respiratory related or whether it is metabolic related. Okay, so the first parameter I want you all to remember is the pH. The normal value of pH is 7.35 to 7.45. So what is pH, guys? The pH is a scale that will describe you whether a substance is acidic or whether it is basic. So it is very important in acid-base balance to know the normal value of pH, the normal range of pH. The second parameter that we have is partial pressure of oxygen, okay, PaO2. The normal range of PaO2 is 80 to 100 mm of Hg. Similarly, the third parameter becomes our partial pressure of carbon dioxide, PaCO2. Okay, the PaCO2 value, the normal range is 35 to 45 mm of Hg. Now simple trick here guys, trick time. The pH normal range is 7.35 to 7.45. Remove that 7, remember 35 and 45 and bring it to partial pressure of carbon dioxide. That makes your normal range of partial pressure of carbon dioxide, that is 35 to 45 mm of Hg. Simple? Yes, very. Now the last parameter I want you to remember is bicarb, that is HCO3. The normal range of HCO3 is 21 to 28. Please remember guys, the 4 parameters: pH, partial pressure of oxygen, partial pressure of carbon dioxide and bicarb. The first condition guys is the respiratory condition. So in respiratory condition we have a hero, that is carbon dioxide. Carbon dioxide gas that we exhale from our body is the indicator of respiratory condition and it is considered to be acidic gas. Please remember guys, carbon dioxide is considered to be acidic gas whose partial pressure normal range is 35 to 45 mm of Hg. Okay, so now in respiratory condition 2 things can arise. The first one may be the body has not been able to exhale adequate amount of carbon dioxide out from your body. It means more of the carbon dioxide has been accumulated in your body. The carbon dioxide is more, means the acidic gas is more. The acidic nature is more. When the acidity is more, the pH will tend to decrease. A substance with pH of 3 is always more acidic than the substance whose pH is 5, 6 or 7. Please don't get confused guys. More the acidic value, lesser will be the pH. So in this condition, when the carbon dioxide is accumulated more, the carbon dioxide value is more, the pH will tend to decrease. This condition, it is known as respiratory acidosis. Let me explain you once again. The pH is less than 7.35, that is indicating you that it is acidic, right? And since it is related to carbon dioxide, it is always a respiratory condition. Okay, in this the bicarb and other parameters may not have changed. Okay, so this is how we identify respiratory acidosis. In respiratory acidosis, we can see the patient, trying to exhale more amount of carbon dioxide out of his body. Like he will be gasping, the nasal flaring can be seen, labored breathing can be seen. Okay, so in this condition, you can always opt with breathing exercises, like oxygen administration. And if it is maybe due to accumulation of too much secretions in the respiratory tract, you can also go with suctioning. And you can consult with your physician and administer the prescribed medications. Okay, so now the second condition that can arise is that the body has exhaled too much of carbon dioxide, that your body does not have the required amount of carbon dioxide left in your body. Because partial pressure of carbon dioxide has to be maintained between 35 to 45, right? So when the carbon dioxide is too much less in your body, it means the acidity is less, right? Acidic gas is less. It means your body is going towards alkalosis. When your body is going towards alkalosis, the pH will be more than 7.45. Okay, so now, and more than 7.45 of pH is indicating it to be alkalosis, and since it is related to carbon dioxide, which is the indicator of respiratory condition, so we conclude it to be respiratory alkalosis. Okay, so I hope you got the difference between respiratory acidosis and alkalosis. I'll revise it again. When the pH is less than 7.35, it is indicating acidosis, and since it is related to carbon dioxide, which is more than 45, it is considered to be respiratory acidosis. And the condition in which the pH is more than 7.45, which is indicating it to be alkalosis, and the carbon dioxide is less than 35, it is considered to be respiratory alkalosis. The next topic, guys, we have is metabolic conditions. Okay, so in metabolic condition also, guys, we have a hero, that is bicarb, HCO3. Just like the respiratory condition, and HCO3, my friends, it is considered to be alkaline. Please remember, the way carbon dioxide was the hero and was considered to be acidic in respiratory condition, here in metabolic condition, the bicarb is considered to be hero and it is considered to be alkaline. Okay, so apart from this, I want you to remember two things. The first thing is that more the alkaline property, lesser will be the acidic nature. Lesser the alkaline property, more will be the acidic nature. So it goes opposite to each other. Okay. The second thing what I want you to remember is that how we measure acidity in a pH scale. I told you long back, a substance whose pH is 3 is considered to be more acidic than the substance with the pH of 5, 6 and 7. So it's not that pH is more means it is more acidic. Nothing like that. The pH is less means it is less acidic. No, it is wrong. Very wrong. Less pH score is more acidic. More pH score is less acidic. Okay, please don't get confused and please remember these two things. So now in metabolic condition also, just like the respiratory condition, two things can happen. The first one, either the bicarb in your body will be too less than 21. The bicarb is less than 21, which is alkaline. The alkaline nature is less, means the acidic property is more, right? The acidic property is more means the pH score will always be below the normal range, that is 7.35. Okay, so now what is happening here? The bicarb is below 21 and the pH is also below 7.35. So this condition, guys, it is known as metabolic acidosis. because the pH is showing less than 7.35. Lesser the pH, it is going towards acidosis. And since it is related to bicarb, it is considered to be metabolic acidosis. In this condition, guys, the partial pressure of carbon dioxide will remain normal. It will be within the normal range, that is 35 to 45 mm of Hg. You will see no difference. So similarly, moving on to the second condition, when HCO3 is too much accumulated in your body, what is happening? It is getting more of alkaline, more than 28. More of alkaline means less of acidic nature. Less of acidic nature means the pH will become more, because as I told you, the acidity, lesser the pH, acidity will be more the pH, acidity will be less. So since bicarb is alkaline, more the alkaline, acidity will be less, and since acidity is less, the pH will be more than 7.45. Both are increased. Bicarb has also increased and pH is also more than 7.45. So in this condition where bicarb is more than 28 and the pH is also more than 7.45, it is considered to be metabolic alkalosis. Why? Because the pH is more than 7.45, it is showing alkalosis, right? And since it is related to bicarb has also increased more than 28. This condition is hence known as metabolic alkalosis. So lastly, guys, I will teach you how to conclude whether a patient is having metabolic acidosis or metabolic alkalosis, or the patient is having respiratory acidosis or respiratory alkalosis. Okay, so now for example, patient A has been assigned to you and you go through the ABG analysis of the patient. You first have to see the pH value. Okay, pH value. If the pH value is less than 7.35, you conclude it to be acidosis. If the pH value is more than 7.45, you conclude it to be alkalosis. This is the first step, guys, to see the pH. Okay. The second step, guys, you need to see is carbon dioxide and bicarb. You see whose value is within normal range and whose value is not within normal range. If the carbon dioxide value is in normal range but the bicarb value is not in the normal range, then what is happening here? The metabolic conditions hero bicarb is not within its normal range. That means it is related to metabolic condition. If the pH is less than 7.35, you conclude it as metabolic acidosis, or if the pH is more than 7.45, you conclude it to be metabolic alkalosis. But if the bicarb is in its normal range but carbon dioxide here is not in its normal range, then you conclude it to be respiratory condition. Either it to be respiratory acidosis if the pH is less than 7.35, or respiratory alkalosis if the pH is more than 7.45. In this way, with 2 steps, we can identify whether the patient is into alkalosis or acidosis, or what kind of alkalosis acidosis he is into. First step, looking at the pH, and second step, looking at the carbon dioxide or bicarb. Whose hero actually is not acting properly, whose hero is becoming a villain here. So whether it is metabolic conditions here, that is bicarb, who is being villain here, or whether it is carbon dioxide, who is the respiratory conditions hero, being a villain here. By this way, you can conclude your patient to be patient whether he or she is in which state: alkalosis, acidosis, metabolic, respiratory, and so on. So I hope this video was useful to you. If you all have any queries, please type it in the comment section below. I will surely try to find out the solution and come back to you. Thank you.